Okay, Carol, thank you. I moved it back to you. We are live on YouTube and EGTV as well.
So I'm wondering if there might be a difficulty for people getting on the call.
We have a lot of attendees that have signed on there.
Yeah, I'm working to move them over to panelists, Doug. One moment.
Okay, Mayor, this is Brett Deichler with the clerks. We can start whenever you're ready, sir.
I'm waiting to see if Commissioner Johnson will be.
Johnson was floating in the attendee list, I think.
Commissioners Johnson and Burrows are both in the attendees.
Oh, okay, thank you. I don't.
Also, Dr. Aaron Corvo and Dr. Alan Greiner too, please.
Okay, Carol, yep. That's what we need.
Just a few more folks in that attendee list to page 3 than usual.
And I guess we can let Emmerich in if you guys want to. It's up to you.
There goes the neighborhood.
We're going to take a vote on it?
Yeah. Emmerich, just so you know, the price of admission is 2 trout.
All right. I just wrote all those names down.
Emmerich, who's going to give you the 2 trout?
I was hoping you would.
Okay, I think for the first part of the meeting, we have everybody on as panelists. So thank you. Before I call the meeting to order, I want to announce that due to COVID-19, individuals are attending remotely. All participants joining by phone should mute their phones when not speaking to avoid background noise. And during the meeting, please make sure that you announce yourself by name and title every time you speak, so the public that is participating knows who is speaking. This is critical given the number of remote participants and is current guidance from the Kansas Attorney General. We'll now call the meeting to order. Clerk, announce the meeting and call roll, please.
A special session is being held on Thursday, January 28th, 2021 at 5 p.m. for a COVID-19 and vaccination update, followed by a presentation on the Safe and Welcoming Ordinance. Roll call. Kane,
Here.
Markley,
Here.
Walters,
Here.
Philbrook,
Here.
Bynum,
Here.
Burrows,
Here.
Townsend, McKiernan,
Here.
Ramirez,
Here.
Johnson,
Here.
Alvey.
Here. Thank you. All right, so 2 items tonight, COVID-19 update and a presentation on a safe and welcoming ordinance. I'll turn it over to Mr. Bach to introduce staff.
Thank you, Mayor, Commission, members of the public. Tonight, to start our commission meeting, we wanted to give an update on where things are with COVID-19, as we have not done that in a while. And then also, as many members of the public are inquiring about the vaccination process and what's happening with that, we're going to go through detail with that. So tonight we have with us the Director of our Health Department, Julianne Van Loo, Doctors Alan Greiner and Dr. Aaron Corbo, who are health officers for the unified government. So I'll turn this over. Julianne, you want to take it from here?
Thank you. Thank you, Doug, Mr. Mayor, and Commissioners for having us this evening. I want to start in a little bit of a different way today than we normally do. Yesterday, the governor did us a great honor and recognized Travis Lanter, our emergency preparedness coordinator in the health department, as a public health hero in the state of Kansas, which is pretty incredible to recognize the work he has done. So this will take just 60 seconds, but I wanted to play her remarks to give some depth to the work we do. You get to hear from me all the time, but you don't always get to hear from our other staff and see the work they're doing. So if you'll indulge me, here we go.
Are others hearing the audio on this?
No.
No,
Negative.
shoot.
I am not.
Well,
I think you have to specify to share the audio when you share the video as well. There should be a control to share audio.
When you share screen, there's a button, there's a checkbox at the bottom you have to hit.
I'm so sorry. Let me see if I can do this quick. If not, we can share computer sound. There we go. All right. I'll start it right here.
Hero of the week. I want
Whoop.
Oh, good afternoon, everybody. As is tradition, I'll start with our Public Health Hero of the Week. I want to recognize the work of Travis Lander, the Emergency Preparedness and Workforce Development Coordinator for the Unified Government, Wyandotte County, Kansas City, Kansas Public Health Department. Travis has worked for months to break down the barriers Wyandotte County residents might face in navigating the vaccination process, ensuring that the entire community is included in the unified government's planning. He set up a process for providing wheelchairs for those who will have a difficult time standing in line for vaccines. He's ensured that non-English speaking residents were provided translators and translated materials. Notably, he spearheaded efforts early on to create a strategic COVID-19 vaccination site design that is both replicable and cost-effective. He actually sketched his idea for the vaccine site's workflow on a pizza box before eventually bringing it to life. And now he routine counsels neighboring county officials on best practices for design, process, and procedures for vaccination operations in the region. Okay, so Travis, if you're watching, I want to thank you for your creativity and your commitment. Your work is paying off in a big way for lots of folks. So now,
Thank you for letting me share that. I think it's important for some of those folks who are working 12 hours a day and don't get to see you to be shown in the spotlight as well. So appreciate that. I'll go ahead and we will dive right in here. Dr. Aaron Corbo is actually going to start us off. Doc, if you want to go ahead.
Sure. Thank you, Julianne. Good evening, everybody. Erin Corvo here, the Deputy Health Officer for the Unified Government. Just a quick situational update and going to talk numbers here. This graph is just simply showing the number of confirmed cases of COVID-19 that we've had over the course of the pandemic. You can see, there early in March, we were, didn't know quite what we were going to be facing. Big spike there in July, and then we've been having a lot of trouble here toward the end of 2020 and into 2021. But as you see, it looks like there's a bit of a drop off there, and we're seeing that in our numbers as well. So just sharing the numbers with you now. Our 7-day rolling average for cases per day is at 48 currently. The average tests per day that we're doing in Wyandotte County is around 530, which is a bit down from where we would like to see it. Our percent positivity rate at this point is 26%, and really that's a lot better than it was. About 3 weeks ago, we were at 40%, and so we're encouraged by that. Again, though, our testing numbers are down, unfortunately, so that worries us a bit, but we're hoping that that signals that people are actually feeling better and maybe transmission is down as well. This is our dashboard here. I want to take you through this. Over to the left-hand side here, you see that the trend in number of daily cases seems to be decreasing, which is good. The trend in percent positivity, it says that it's increasing here. I want to remind you that we look sort of at the 14-day trend and also the 7-day trend. There's a lot of bouncing around in those numbers. So it says here that it's increasing. These numbers are from, I believe, the 18th to the 24th of this month. But just recently here, we're actually seeing more recently a bit of a downtrend, which is good. Our trend in test turnaround time, it seems to be increasing, but let me just tell you, not by much. We were at about 18 hours turnaround time. Now it's up at about 21 hours. And so we're always working on that. And of course, that includes all testing facilities within Wyandotte County. The trend in number of tests per day is decreasing, as I discussed. And a piece of good news here at the end is that our regional hospitalizations seem to be decreasing as well, which we hear pretty consistently on the calls with Mark, the Mid-America Regional Council that we've been joining. Next slide, Julianne. Thank you. I want to go through a couple more slides here about perceptions from our community in Wyandotte County. We were able to administer a survey to several, really hundreds of Wyandotte County residents. And these results that I'm going to share with you is about half of the results that we have back, represents about 800 people living in Wyandotte County. So how serious is COVID-19? Well, it's good news here that many people in our community feel that it's extremely serious, or at least moderately serious. And so about 90% of our community feels like this is a really big deal. Next slide. This slide simply shows, this question: if there was a vaccine that was approved by the FDA and was it available, would our community members take it? And this was also really encouraging. Over 70% of them said yes, which is fantastic. So our job is, of course, to get the vaccine and get it out to people. This slide is kind of interesting to us. We were wondering, for those people who said no to the previous question on if they would receive the vaccine or not, why not? And they said mostly that they're really concerned as to what that vaccine might do to them in the short term, in the long term. Are there risks, and might they have an allergy to it? So that really makes up the most of the no's to that survey, which is very interesting. So it gives us a sense of sort of how we need to get more information and education out to our community as well to be most effective in getting more people in for vaccines. Next slide. And then this says here what information would make it more likely for you to get a vaccine. And we're seeing here that people want to see others in the community who they know getting the vaccine. And so I want to say a big shout out to our Health Equity Task Force this evening. Many of those folks have said, yes, I'm going to put my vaccination story out on the internet, on social media and such. Many of us in the health department have chosen to share our stories as well. And I know that many of you have too. And that makes a difference. So I think people want to know those who are getting vaccinated and want to talk to them about what it was like. We have made the vaccine free to everybody in Wyandotte County. You don't need insurance to come and get that. The vaccination, our community wants it to be brought to places where they are, where they frequent, and we have plans to do that. We are actively working on creating what we call a drop team that could, in the future, come into certain businesses and give the vaccine if necessary. We're setting up sites, which will be talked about really soon here in the far east and far west of parts in Wyandotte County. So we're trying to make it really easy for people to come and get the vaccine. And then there's also this interest in non-traditional hours. I think that means weekends and evenings and possibly early mornings. We're also working hard on making our hours more accessible to the public as well. Next slide. I'm going to now pass off to Dr. Greiner for some frequently asked questions.
Thanks, Dr. Corvo. And these are primarily regarding the vaccine, and we'll just go through these quickly. Is the vaccine safe? In our opinion, yes, absolutely, the vaccine is safe. Has the vaccine been through rigorous clinical trials? Yes, we feel like it has. We've had tens of thousands of people in those trials. Of course, we've now had tens of millions of people receive the vaccines. So that's all good news as well. The CDC is watching closely for safety issues. There's a whole rigorous reporting system around that. And we have emergency use authorizations for both the Pfizer and Moderna vaccines. And we expect to have additional emergency use authorizations on other vaccines in the near future. What can we tell you about effectiveness and those clinical trials? So for the Pfizer BioNTech trial, there were almost 44,000 participants. Half got the real vaccine, half got a placebo shot. And in the follow-up, the multiple month follow-up of those individuals, those that got the real vaccine were 95% less likely to get COVID infections where they were symptomatic. For Moderna, it was almost 30,000 individuals, same setup. And again, almost 95% effective, 94.5. So really the same, which was a really, really positive result. Next slide. What side effects can we expect? Well, many of us have now been through this and had the temporary pain in the arm where you get the shot, much like you can get with a flu shot or the other type of vaccine. Some folks have reported headache and fatigue, muscle pain, joint pain, fever, chills, flu-like symptoms. Most people have reported more of these kind of things after the second shot, but it really varies from person to person. And I really feel like we're not seeing severe side effects that would make a person have to miss work, for example, that you may have heard about in the press. We're just not seeing that, so that's good. Next slide. Is just one shot okay? No, for these two vaccines, we really feel like two shots are what's necessary to protect a person. For the Pfizer BioNTech, it should be given 3 weeks approximately after the first dose. For Moderna, it's 28 days. There is a window to that, and so with our vaccination operation, people can come in within about a 4 to 5 day window, which is fine. So how much do we know about one shot? We really don't know how protective one shot is. We think that it maybe offers some protection, but we really are going to work hard to try to get people through for that second booster shot. Because again, all that clinical trial data we talked about is based on people getting 2 shots and that getting you that 99% or 95% protection and having your immune system remember it. You're not protected right away. We really feel like even after that second shot, it's going to take about 14 days for your body to produce enough antibodies to give you that full protection. For Pfizer, it may be a little bit less, 7 days, but we're kind of encouraging people to think of themselves as fully safe after 14 days after the second shot, because the antibodies do take time. And we really got to get people to continue to mask and social distance. Remember, you can get vaccinated and get your 2 shots, and we still think it's possible for you to get COVID. You just may have no symptoms at all. But if you've got COVID, you could spread it to somebody else. So that's why we'll continue to push masks and social distancing until we feel like we've got the virus out of our community and no longer spreading. Next slide. Do you have to quarantine if you're exposed after you've been vaccinated? No, you do not. So after the second shot anyway, right? So if folks are past the second shot, what we're saying is even if they're 1 day past that second shot and they have an exposure to a COVID case, then they do not have to quarantine for 14 days. So another benefit to getting the vaccine. We still want people to get tested. We are going to have to work really hard to keep getting people tested who get any symptoms that could be COVID. So this will probably go on for months and months as we're rolling out vaccine and encouraging folks to get vaccinated. If people have sore throats, if people have congestion, if people have a fever, even if they think it's just a common cold or a strep throat, let's get those people tested for COVID so we can track what's going on and really see when we've got it knocked out of the community, because that's when we can go back to starting to change some of the infectious disease control measures like mask wearing and social distancing. So that may be it for me. Is it back to you or do we have another one?
Yes, it is back to me. Thank you. We just wanted to dive in with those because we know those questions will inevitably come up from all of you and from many others in the community. And now we'll spend a few minutes just talking about what our strategy is for vaccinated Wyandotte County residents and what our challenges are. Many of you probably know our primary strategy will be 3 large sites across the community. Our Kmart site is up and running. We are launching a Western site out at the Legends area next week. We would be ready to start actually inoculating folks there on Monday, but we just don't have enough vaccine to do that. But we are pretty staffed and ready next week if we start to receive larger quantities of vaccine. And then we will be launching a site in the eastern part of the county, likely the week after next. All again, only worth getting those sites up and running if the vaccine comes. So we'll let you know what our official launch dates are when we have that information. We, of course, will also engage our health systems and providers. We have done that routinely. Our hospitals, our federally qualified health centers, our pharmacists will all be really key to this, especially as we get to later phases into the community, into the broader community availability for the vaccine. When it's available to most people, we'll need to drive some people to their primary care providers, to their pharmacists, but we don't think that will be for another month or two, as we think the next couple months will largely be driving folks to our sites as we get larger and larger allocations of vaccine. We are, as Dr. Corvo mentioned, planning to deploy some vaccination drop teams. These will really be on just an exceptional basis. We won't be able to take these folks everywhere that we want them, but of course we need to vaccinate places like our inmates in our jail, folks with disabilities who are in congregate settings, those sort of places where it would be really difficult for them to bring folks to us. We will be prepared to bring the vaccine out to them. We are also working to identify creative transportation options. We know that that is a barrier for people. So more to come on that, but our 3 sites are along bus routes and we're working with other providers to see how we can offer up transportation options to the public. And then of course, continuing to push our straightforward, culturally appropriate messaging and really trying to take the information that we gleaned from that survey that Dr. Corvo mentioned and using that in our messaging and in our decision-making to try to get people the information they need to make the right decision for themselves. So our main challenge, of course, above and all else, is the vaccine supply. It is low. I'm going to talk here in just a moment about what we have on hand and what we think we're getting. But the other real challenge is the visibility. So we only find out a couple of days before vaccine kind of lands in our lap. So for example, we found out on Saturday night at 10 p.m. that 2,000 doses would be coming this week between Monday and Wednesday, which is incredibly difficult in terms of scheduling because we can't schedule folks on Monday and Tuesday then because we can't guarantee we have vaccine. So there's a little lag time there, and then we kind of hurry up and rush to schedule folks as quickly as possible. So we're really hopeful. The Biden administration has put out publicly that they're trying to create a 3-week line of visibility. So to give us an idea of what's going to be coming, not just next week, but the 2 weeks following, which will help us tremendously. So very anxious and hopeful that that will begin to materialize here shortly. Of course, battling misinformation and distrust. We're conducting focus groups in the community. We continue to engage with all various sectors, including a lot of our local businesses whom we met with earlier this week, to again, hear from them about what they're hearing, what they're worried about, what information they need to get to their employees, et cetera, to just keep pushing the messaging that this is a safe and effective vaccine. We do struggle to some extent with staffing vaccine sites. That is improving. We have had a lot of volunteers step forward, which is phenomenal. We We are pulling from students who are medical students and pharmacy students and those folks as well. But that will just be because we're trying to get 3 sites up and running. It will be a challenge for another several weeks until we fully have our workforce up and running. I mentioned transportation, and then reaching our non-English speaking residents and workers will certainly be a priority for us. So we work with a lot of the Spanish speaking media in our community to do that, as well as local social service and other agencies who represent that population to make sure that we're getting the information they need to those folks. So how's supply look? So we were originally receiving Moderna and my apologies. We began receiving Pfizer last week. We got about 975 doses. This week we got just shy of 2,000 Pfizer doses. And we just found out that next week we should expect the same, another 2,000 doses. So all this to say that that's very slim. We have had a little bit of help from our local partners. Some local FQHCs or federally qualified health centers, Vibrant Health and Swope Health have given us some doses. KU have given us some doses and Family Healthcare as well. So there really is a community effort here to try to share doses, get them to the people who need them the most, who are at highest risk. But again, at the end of the day, we just continue to see a really limited quantity for the population size that we have. Last little section here, I want to talk a little bit about prioritization, how those decisions are made or what decisions have been made, and then what we have control over here at the local level. So to start with, we have completed vaccines for some of our groups in Wyandotte, which is wonderful. We've completed the health department, our EMS staff, the large majority of healthcare workers in our community. We think we're probably have offered at least the vaccine to between 90 and 95% of our healthcare workforce. We know there's a little bit more to go. There's some folks straggling in, but all in all, we've offered that to the large majority of healthcare providers in Wyandotte and the large majority of public safety folks as well. So we've gotten through our police and fire. I think we have like 12 or 13 sheriff's office folks to come through tomorrow, and then they're all done as well. So it feels nice to be making some progress on some of these first priority groups. Just want to share this. A lot of you may have seen this already. The governor put out a kind of modified graphic here of the phases of eligibility for the vaccine. We are now in phase 2, which is persons age 65 plus, congregate settings, high contact critical workers, and then of course anybody who didn't make it in phase 1. And for a population the size of ours, we estimate this is somewhere between 40 and 60,000 people, which makes it really difficult, right? If you have 2,000 vaccines, how do you decide among these 50,000 people who gets those? So what we've had to do at the local level is make some additional decisions and do some additional prioritizing. So we have done that. We have heavily prioritized our K through 12 educators, our childcare providers, our public transit folks, our DMV staff, our postal service workers, and next week moving heavily into our grocery, food service, and food processing workers. We've made this decision because these are all very essential functions in our community that must happen face-to-face in the community, in person, and cannot be done at home. We know how imperative it is for our children and our broader community to have them in the classroom, and same with our childcare providers. We cannot go without public transportation and our postal service, some of those things. And then we also have had a fair number of clusters and outbreaks in our grocery, food service, and food processing sectors. So those are folks at particularly high risk, and those are folks who feed us and keep the rest of us moving. And so we know this is difficult for a lot of people, the way we have chosen to do this prioritizing. We have chosen to do it in a way that tries to protect those who are doing their job and putting themselves at risk by serving the rest of us. We particularly know that this is a little bit difficult for our older folks in our community who are seeing different states and different counties in different phases, and some of their peers in different communities getting vaccinated before them. We want folks to know that we are very, very soon going to move into our older population as well. Our hope is that next week we'll begin scheduling vaccines for our 80 plus population. We would like to prioritize those oldest among us, so our 80 and 90-year-olds. We've actually have many hundred 80 and 90-year-olds fill out our online survey, which is excellent. So they will start hearing from us next week as we get them scheduled, and then we will work our way down to our 70-year-olds and our 65-year-olds the week after that. So we want folks to know we're coming to them soon, but again, right now with only 2,000 doses a week, it's just such a limited amount that we're able to push out. So the big question for a lot of other people, and I want to know a lot of you know this by now, but we have a form on our website, which is basically the best way for folks to let us know that they are interested in getting the vaccine when they are eligible. So folks can go online or they can call 311 and have that filled out over the phone on their behalf. You can also fill this out for somebody in your family, for a parent or a loved one. We're really encouraging that. We've sent this link to all the healthcare providers in the community that we have contacts for and are asking them to fill it out on behalf of their patients when they come in for medical appointments. We've done the same with a lot of our social service providers who are helping people enroll this way as well. If you have access to people in your community, if you have a network of folks, we'd ask you to push this to them and ask them to help get people signed up who are in their life as well. So this is the single best way to get into our system. Today, for the first time, we started pushing out proactive messaging to folks via email, text messages, and voicemails. So you'll start seeing those and hearing those. If you filled out this form, you'll start hearing from us. Our goal is to start doing this weekly, a weekly push out from us to anybody who's signed up or filled out the form so that they just continually get information from us. Everybody won't be eligible next week or the week after, but we want them to know that they're in our system, we have their information, and that we ensure that we will get to them as soon as we have enough vaccine to be able to do so. And we'll leave you here with our victory wall, I think we've been calling it, where we ask folks to sign once they've been vaccinated. It's really encouraging for the team to see this fill up every day as more and more folks come through for their first and second doses. And obviously the governor here on the right-hand side signing when she visited us last week. So I think that's all we've got. Happy to take any questions.
Thank you, Julianne. Commissioner Philbrook?
So thank you again, Julianne. I would tell you that this morning at the Livable Neighborhoods meeting, this presentation rolled out and it was great then, just as well as it was this time. And we had a couple actually sign up at that location that you just advertised, and they heard back within a few minutes that it had been accepted, and they were just elated. So there was a lot of people listening to this. So yes, exactly. Also want to be an advocate for folks getting their inoculation, because as you well know, Julianne, I've had both of them now. I just had my second inoculation yesterday. The reason for my early inoculation is because I'm an optometrist and I see people definitely within 6 feet, how about arm's length, all day long. And so I've been blessed and not had COVID, but nor do I want it, nor do I want to spread it to anybody. So I just want to tell everybody, if the old doc can do it, you can. So get out there and get your arm shot because I guarantee you, I don't want it and I don't want any of your family to get it. So thank you so much, Julianne.
Thank you, Commissioner.
Commissioner Johnson, you had your hand up. Didn't know if you wanted to.
Yeah, yes, I do, Mayor. Thank you. Julianne, thank you. And Dr. Corvo, Dr. Griner, everyone, thank you for the work that you're doing. We say this I think we feel like we must offer thanks before we offer any other questions or critiques because of the work that you all have been doing. I'm curious, one, have we run into situations where we have run out of doses up to this point?
Last week, in fact, by Wednesday, we had gone through our stock, and Thursday we actually sat in an empty site for a day because we did not have enough to give out. So yes, okay. we try to schedule as best we can so we don't have days where we're fully closed, but sometimes it's unavoidable.
Okay, yeah, I was just curious about that. The second thing is the same thing that, the same challenges that we had with regards to testing, I think are going to be similar to what we will deal with in terms of vaccinations, and particularly in the African-American community. I think I don't know if it was Dr. Corvo or Dr. Griner that mentioned that, there is still a fear factor or a sense of skepticism, I think, in certain communities of color. And so the work that we've done in terms of getting into the community with regards to testing, I think is going to have to be reciprocated as relates to our vaccination processes once the time is available, once we have enough vaccinations that are available to go out into the community. I think we'll have to use the same type of processes in engaging particularly communities of color.
Completely agree. And the way you start on that is to know what's happening, right? To get access to the data of who's getting vaccinated. So in fact, we've gone rounds with KDHE, the state health department recently. Previously or earlier this week, in fact, we were not getting access to vaccine data anywhere except for our health department site. So we didn't know who's getting vaccinated at other sites in the community, which doesn't allow us to accurately put on our website the race and ethnic breakdown of who's getting vaccinated. They have since changed their mind and are working with us actually today and tomorrow to start getting us access to that data. So our plan is absolutely to be transparent about who's getting vaccinated, especially the demographic breakdowns. My hope is we can start getting some of that up on our website as earlier as next week, but couldn't agree more. We have to make sure we're getting this to our high risk diverse populations, and we have to start with the data.
Commissioner, I just wanted to add as well that, our community is already asking for this information, and rightly so. And so we're already working in the background to be able to at least report out our numbers from the health department. And as Julianne mentioned, I think we're going to have a lot more data soon. And so I think we're really, again, just really committed to transparency on this issue. It's going to be really important. I also just want to say that our public information officer and our team has been working diligently, I think, on the messaging around this. And we've had so many wonderful community members as well. For instance, Darren Story and others who have put out on the radio, who are creating sound bites and posts on social media and stuff to say, hey, I got it and I'm doing great. So all of that helps, and we're continuing to ask folks to be brave, put it out there.
Thank you. I'd be remiss if I didn't remind that we do have a 6:50 hard stop, so we can transfer over to the 7 o'clock session. And we do have a lengthy session after this, so we will continue. Commissioner McKiernan.
Thank you. My apologies if this has been asked and answered, but I assume Moderna and Pfizer are mix and match, that if someone had the Moderna for shot 1, they can get Pfizer for shot 2?
They are not actually. That's a good question, Commissioner. Thanks for bringing that up. We're really wanting to stay with whatever manufacturer you get initially. You would get then your second shot, that same manufacturer. About 5 or 6 days ago, the CDC did come out with some messaging around this, and they said, in extreme circumstances, it is likely okay and probably going to be effective if somebody were to mix and match, to get one dose of one and then the other. However, because the studies were not done in that way, and it was not approved emergency use authorized through the FDA that way, we're really wanting to stick with the same manufacturer for each person.
Interesting. I know that we had Moderna early on at our vaccination site, and the presentation tonight said that we've been getting Pfizer most recently.
So I apologize if I miscommunicated there. We still are receiving the second doses of the Moderna to match the first doses, but the new first doses we're getting are now Pfizer. My apologies.
Thank you.
Thank you. Thank you again for a great presentation. We'll now move on to our presentation on a safe and welcoming ordinance. I'd ask Mr. Bach to introduce our guest, except I think what I'm going to be doing first actually is sending this over to Commissioner Johnson to open up this item.
Thank you, Mayor. Appreciate that. Just have to get my notes so that I can make sure I sound articulate tonight. It's a very important matter. For over 5 years, there's been a groundswell of community support for some means of identification for those who are undocumented, as well as an ordinance that would help to build trust between the law enforcement community and the undocumented community here in Wyandotte County. It's a community that calls Wyandotte County home. Community folks that work here in Wyandotte County, purchase goods and services here in Wyandotte County, pay respective taxes in Wyandotte County, and support and build up the local economy of Wyandotte County. In November of 2019, I stood before a packed house at the First Baptist Church, and I gave my commitment that I would introduce safe and welcoming to the commission for its consideration and for dialogue. It's my hope and desire that we consider this tonight with an open mind and heart. It goes without saying that Wyandotte County is an immigrant community. We all know that. It's full of rich heritage. And as one of the most diverse communities in this nation, I believe it is critical that we embrace that diversity at a policy level. I'm pleased that Commissioners Bynum and Ramirez and McKiernan have all helped to shape the dialogue that we'll engage in tonight. Our community partners they understand that we may not agree on all matters, but I am optimistic that tonight we can have an authentic conversation about safe and welcoming, and that we can hopefully figure out a path forward that allows all Wyandotte Countyans to feel a place of belonging, because I believe it is simply the right thing to do. At this time, I want to call for Ms. Lauren Bonds, who has been working on behalf of our community partners to talk about the primary aspects of safe and welcoming. Lauren, are you on tonight?
I am. Thank you, Commissioner Johnson. And I'll go ahead and jump in. I know we're limited on time. Mayor Alvey, members of the commission. My name is Lauren Bonds, as Commissioner Johnson mentioned. I'm counsel to the Safe and Welcoming Coalition, and I'm here to testify on their behalf tonight. As many of you probably already know, the Safe and Welcoming Coalition is a collection of faith groups, civil rights organizations, and community service providers who joined together for the purpose of passing and advocating on behalf of a municipal ordinance that would ensure access to public services and make sure that everyone had the opportunity to feel safe and at home in Wyandotte County. I am going to go ahead and share my screen and just want to make sure that everyone has the opportunity to see. Can everyone see my screen? Okay, I'm going to go ahead and switch this to present if I can. I'll just go ahead and continue to quickly discuss what the Safe and Welcoming Ordinance is. I think many of you probably know. The Safe and Welcoming Ordinance has two key provisions. First, it has a municipal ID provision. That's fairly straightforward. It provides identity verification for Wyandotte County residents within the county limits to access important public services. It will, people who otherwise don't have a photo identification, it gives them the opportunity to use this municipally created ID as that form of photo identification. The second provision of the ordinance that the Safe and Welcoming Coalition has proposed is an ICE non-compliance provision. This affirms that Wyandotte County law enforcement is not going to take on frontline immigration enforcement on behalf of the federal government. It also ensures that there's not going to be collaborations with ICE and other immigration enforcement agencies that would expose members of the Wyandotte community to deportation. Now, I think that these may seem like they are two distinct, detractable, provisions. They're actually quite intertwined. You can't have a municipal ID without an ICE non-compliance provision. And the reason for that is members of the Wyandotte community, particularly non-citizen members, are going to be very concerned and potentially chilled from sharing their information and obtaining a municipal ID if they don't have the confidence that the Wyandotte County government is not going to share their information with ICE that could lead to their deportation. Now, I know that we're short on time, and I know that the majority of the commissioners' concerns or potential questions and potentially misconceptions about this ordinance really center on the ICE non-compliance provision. So I'm going to focus the remainder of my time on that, but I'm happy to answer questions about either provision as we move forward. Now, I think the largest and most overwhelming concern that we've heard from the Wyandotte County legal office, and the unified government has been incredibly helpful in providing us access and having conversations with the legal y'all's legal department. I think one of the most overwhelming concerns, though, has been that if the ICE noncompliance provision of the Safe and Welcoming Ordinance were to be adopted, it would force the unified government to violate federal policing grant conditions that have been imposed upon it. Now, I'm going to go into the reasons why I think those conditions are illegal and not binding or legally enforceable, but we do want to acknowledge that concern. And so we've proposed this language as a workaround for that concern and as an acknowledgement for that concern. So, we acknowledge that, these conditions are in place, and to the extent a specific department or specific policing agency is subject to these conditions, we recognize an exemption to the extent that there are imposed and legally binding federal contract requirements that they respond to ICE. So this is a language that we propose. We haven't really had an opportunity to hear a lot back about this condition, but we think this could resolve the potential concerns about violating federal grant conditions. So this is what we propose. I'm just going to leave it up here for another second to make sure everyone has a chance to read it, see if they feel comfortable with it. But this would, acknowledge that to the extent the Kansas City Police Department or Wyandotte County Sheriff's Department feels that they need to respond to ICE as required by an existing federal contract, they would have the opportunity to do that as the ordinance is currently proposed. However, I do think it's very important to explain that so many of these grant conditions have been struck down. They've been struck down in the First Circuit, they've been struck down in the Third Circuit, they've been struck down in the Seventh Circuit, they've been struck down in the Ninth Circuit. Virtually every federal court of appeals who has considered these federal grant conditions that require municipalities to comply with requests from ICE and share information pursuant to requests from federal immigration enforcement agencies, have found that these conditions violate the Administrative Procedures Act of federal law and the 10th Amendment of the Constitution. Another court that's found this has been the District Court of Colorado, in the case of Colorado versus the United States Department of Justice. Now, this is a case that the Department of Justice has appealed to the 10th Circuit. The 10th Circuit controls Kansas. Kansas is part of the 10th Circuit. This appeal is currently pending, and we believe that there will be, unless the Biden administration withdraws the appeal, we could have a determination that's legally binding on Kansas as to whether these conditions that are a matter of concern are binding. We could have that decision as soon as the summer. That being said, in the meantime and in the interim, there is an acknowledgement that these conditions may be binding and will permit the law enforcement agencies of Kansas City, Kansas, and Wyandotte to respond to ICE and other federal immigration enforcement agencies as if the conditions of their grants are binding for the work that's covered by the grants. I want to move forward and just acknowledge a couple of other facts that I think are important with respect to the Wyandotte County government, considering whether complying with these conditions or potentially violating these conditions would expose the government to legal liability and risk. I want to note that the Department of Justice has never sued to enforce these conditions as far as we've been able to see. All those cases that I just mentioned, those have all been situations where the cities or the states have sued proactively in order to provide their constituents with the assurance that they weren't going to be sharing their information with ICE. And because their sage legal counsel did some research and determined that these conditions would not be enforceable. Additionally, the Department of Justice has not withheld funds from any of the cities or the states that ended up suing. These were all, as I mentioned, proactive situations where the municipality went out of their way, filed a lawsuit before any funds were withheld. And no funds have been withheld in those situations as far as we can tell. I would also note that these conditions aren't common for federal policing grants. These conditions were not imposed prior to 2016 when the Trump administration took over the Department of Justice. I don't think it is logical to assume that they will be imposed after 2021 for any future grants. So I think really the only question we're discussing at this point is whether these grant conditions apply to existing grants that the Wyandotte County government has entered into. And as we mentioned, we've got a workaround for that. We acknowledge that to the extent these government grant conditions apply to certain programs or certain policing activities, those are situations in which the government would be permitted under the ordinance to respond to affirmative ICE request or other requests from the federal immigration enforcement agencies. So I want to pivot very briefly and just wrap up by discussing another concern that we've heard, in our conversations with Wyandotte County's legal counsel and other folks. And that's this question about the sheriff feeling concerns about denying ICE access to people detained in Wyandotte County jails and otherwise in Wyandotte County detention. Respectfully, I think that this is a much more important area for which the unified government should be concerned about liability. Courts have consistently held that the Fourth Amendment prohibits, any individual being detained in order for ICE to interview them, investigate them, or any other ICE contact, right? The Fourth Amendment only permits you to detain an individual because you have probable cause of a crime. This has resulted in six-figure settlements and verdicts in a number of different municipalities and counties. And this is not, this is for the decision to grant ICE access to jails and detain individuals in order for ICE to interview them. And I just, on the PowerPoint, I highlighted, 3 different jurisdictions that recently were hit with pretty significant settlements or verdicts as a result of their decision to detain individuals. So ICE could have contact with them, interview them, deport them, what have you. And I think it's just important to note within this context that a number of people can end up in jail without engaging in serious criminal activity, failure to pay certain court fees, failure to appear for court hearings and other things can result in you being detained in jail. And so subjecting individuals to deportation for nonviolent, non-felony activity presents a serious moral question in addition to some of the legal questions that are presented as well. I will go ahead and stop sharing my screen and provide you all with the opportunity to ask me any questions if you have them.
Well, Lauren, we'll hold off for right now. We ask that you stay close. We'll definitely probably have to come back to you for a clarification on a few things. I think in the interest of time, we want to hear from our legal staff that's here. I see Misty is here. I know also Casey Meyer, Susan Alec, and Claudia O'Donnell are here to bring some perspective and insight from the UG. So I'll turn it over to them at this particular time. Ladies, it's in your hands.
Thank you. Good evening. I think that I'm going to start off our part of the presentation with the community ID portion. I think Susan is running our PowerPoint.
Yes, I'll share my screen. There we go. Do you see it?
I do.
Okay.
Okay, so I'm Casey Meyer with the Unified Government Legal Department. So currently there is no state or federal law prohibiting a city government from creating or enacting or authorizing a city ID program, or in our case, a community ID program. As Lauren indicated, I think this was brought forth to try to give an opportunity for people who are otherwise unable to obtain an ID to have access to an ID. Some of those individuals I think would include undocumented individuals, unsheltered, which is homeless population, minors, people recently released from the Department of Corrections who might not be able to obtain ID. And so while we are unaware of any city in the state of Kansas who have set up a city ID program, other cities in the United States have. But here on this slide are a couple of potential legal issues that could apply. And I'm going to start from the bottom. One main concern would be the privacy. So it would be a goal, obviously, to maintain personal identifier information and records in a manner that supports confidentiality for the applicant. And as you know, the city would be subject to the Kansas Open Records Act and FOIA, whereas if the city contracted with a third party, that party wouldn't necessarily or would not be under those same obligations under CORA. Second, reliability. Obviously, you would want to somehow ensure sufficient quality control of how you get access to the identification, because that would help with how it's accepted in the community. But more important, on a legal level, you would want to do that in an effort to deter fraud. So quality control for the ID is important in order to deter fraud. And then, of course, up top there, procurement. If this is pursued, obviously, whatever avenue this is pursued, we would have to comply with our unified government procurement policy if the city was participating in this program. So I'm done. I think there are a couple different models that might accomplish those goals. And I know that Claudia has done some research, and I'm going to let her take over.
Thanks, Casey. Good evening, Commission. This is Claudia O'Connell, Fiscal Officer in the Budget Office. So the last time we were together, we spent a lot of time discussing the municipal ID. And since that presentation, we've done research on various other types of models, and that's how we discovered the community ID model. So the particular model that we're going to look at tonight was created by a nonprofit group called Faith Action International House out of Greensboro, North Carolina. And basically, Faith Action International House works with nonprofit organizations, faith communities. Oops, go back. Sorry. They work with faith communities and community groups to utilize their ID drive and dialogue model. And this collection of groups is what's known as the Faith Action ID Network. And these cards are basically for individuals who may not have access to a government issued ID. Okay, next slide. So this is a brief overview of how their model works. So Faith Action works with their network partner. So this is either going to be a local faith group or nonprofit to train, provide materials and resources to hold a successful ID drive. All participants must attend an ID drive and then go through a mandatory orientation. And the orientation is basically to educate applicants on the benefits and limitations of the card within that particular community. And then the next step would be the vetting process. So a proof of identity and residency is required for these cards. And I think it's important to note that at each one of these drives, either a DOJ representative, an attorney, or a paralegal is present to authenticate the documents or to answer any questions that may arise. And then finally, the card is printed and mailed to the address that is provided by the individual. And this is, as opposed to just printing it that day at the drive, it sort of adds another level of integrity to the program. Okay, next slide. So as mentioned, applicants must prove their identity. So this is an example list of the documents that an applicant could bring in to do so. I'll give you all a moment to take a look. Okay. And these are more examples of proofs of identity that could be brought in. And 2 of these must be provided. Okay. And then this is an example list of the documents to prove one's residency within the city. And one of these should be provided. Oh, go ahead. So acceptance of the community ID is dependent on of participation. So these are some of the community partners that could potentially accept the ID. So our local law enforcement, city departments, certain businesses. And then I also think it's important to note that our health department has indicated that they would accept this ID, but they don't currently require an ID to receive services. Next. And then this slide's just a reminder that the community ID would only be accepted in Kansas City, Kansas. So it could not be used as a driver's license. It wouldn't allow entrance into a federal building, it wouldn't allow you to board a plane. It could not be used to purchase alcohol or tobacco. And it would not be accepted by a state or federal agency to prove identity. So those are the end of my slides. And I'm gonna go ahead and turn it over to Susan Alec.
Okay, I have some information about the safe and welcoming section of the ordinance. And I guess I'll back up and say that I'm Susan Alec. I'm legal counsel with the UG Legal Department. I've been working on this since last spring with Casey and had multiple communications with Ms. Bonds as well. So I think that the theme for my piece of the presentation tonight is that I want to help the unified government avoid unintended consequences associated with the safe and welcoming proposal. So this is a proposal that has the potential to have adverse consequences to the unified government. I think that we found a way forward, and I'm looking for direction from the commission about how it wants to go forward, but I do want to tell you about some potential problems. So as we discussed last spring, the unified government is involved in a number of federal local task forces, and those do great work in our community to prevent and detect crime. They also bring in some funds. So anytime we're looking at potential safe and welcoming language, we want to avoid language that's so broad that it would prevent effective communication on those task forces. So when we're looking at a provision that limits communication between unified government employees and the federal government, it needs to be language that still allows for those task forces to function. The next issue is grants, and Ms. Bonds summarized a lot of case law, and there has been some litigation between cities and the Department of Justice regarding grant provisions, and that's important. But there's also the aspect of the credibility of the unified government when it signs grant assurances. So we have a number of grant assurances that we have signed that apply to grants that are still in effect. And those grant assurances essentially said, we do business a certain way here, and we are certifying that that's how we do it. Passing an ordinance that conflicted with those grant assurances could be problematic for the unified government in the sense that we would then need to send our new ordinance to the grant organizations and say, actually, we've changed how we're doing business. So we assured you that we were doing it one way, we've now changed. And those consequences are somewhat unpredictable. So that is an issue to keep an eye on. Some of the proposed language in the Safe and Welcoming Ordinance actually just conflicts with federal law. For example, federal law requires communication between the detention center and ICE. So trying to prohibit that on the part of the detention center exposes the unified government to some potentially unforeseen consequences. And then finally, The proposed language by the ACLU and the Safe and Welcoming Coalition purports to apply to all of Wyandotte County, which brings up a lot of jurisdictional issues. For example, we don't know what Bonner Springs and Edwardsville think about this. Additionally, there are a number of issues associated with involving the sheriff's office, given that the sheriff is an elected official who has the power to make policies for his office, and the specific rules governing the way jails communicate with the federal government. So we think that we found a potential path forward. We looked at what Roland Park passed in December. Roland Park is a city, so Roland Park's ordinance doesn't have any of the county functions that we as the unified government could potentially have. So it avoids those problems. We looked at it and compared it to the grant assurances that we've already signed, to the federal law that we believe applies to us, and made modifications based on that. So that is a potential way forward, but we are looking to the commission for direction about which way you all want to go with this. And I will stop my share and turn it back to you all.
Thank you, ladies. I appreciate that. Mayor, I want to hear from Commissioners Ramirez, Bynum, and McKiernan to the extent that they like to have comments, and then we'll turn it over to you and the remainder of the commission for discussion at that point.
This is Commissioner Bynum. I'll go first if you don't mind.
Great.
First of all, Mayor Alvey, I want to say thank you for allowing the conversation to come forward. I really do appreciate that. I'm a very strong supporter of our law enforcement, our police, and our sheriff. And I think those in those departments know that and have some familiarity with my more than 20 years of working in a very grassroots way with law enforcement and with neighborhoods. One thing we've learned over these decades of that work is often what our neighbors need is a helping hand rather than a costly ticket or a citation. It strikes me that over the decades of working with strong neighborhoods and problem solving with not only our police, but livable neighborhoods and the departments of the Neighborhood Resource Center, we as a government have continuously and increasingly moved toward compliance and assistance rather than just being in punishment mode. I will say there's definitely a time for punitive measures, but overall, I think we can agree that being a partner with our community brings much higher dividends. We found this to be true in our mental health system and in our housing conversations. Investing in mental health, investing in housing is far less costly to taxpayers than using government resources to mitigate the impact of those who live with mental illness or those who struggle to remain safely housed. Our Kansas City, Kansas Police Department and other law enforcement crisis intervention training shows this. And that's a program we've had in place for at least 5 years now because it works. And it doesn't work because it's a punishment. It works because it's a partnership. I believe a community ID and a safe and welcoming ordinance can bring a culture to our community and can do the same thing. I feel very strongly that we as a community and a governing body can be better than just being anti. We can be a community that embraces all that's offered to us. If we believe in our adopted strategic goals, then I don't think we get to decide for whom we've adopted those goals. And to my colleagues, have you ever had an experience where either in this work or in some other aspect of your life, the rules that were put in place don't seem to be being followed? And that frustration as we perhaps lash out about why aren't we following the rules? I'm struck by one of the many incredible things that Dr. Martin Luther King Jr. said. He just wanted America to follow the rules we put on paper. I believe a safe and welcoming ordinance, and frankly, more important, a safe and welcoming culture, far better serves our community than does the reasoning being used not to create such a culture. I heard more than one story in 2020 of families in our community who were hungry, but would not access food for fear of having their children taken away. There is no world or circumstance in which that is okay. You know, in our preamble to our Constitution, it says we hold these truths to be self-evident, that all men are created equal, that they're endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. That's what I think Dr. King was referring to, those words that we put on paper. There needs to be a base level of trust among the community with the community ID and a corresponding ordinance. The building of trust can be something that moves us forward. I want to reiterate that in no way is a commissioner or member of the coalition we've been working with advocating that we don't track down, arrest, and adjudicate those suspected of or being charged with committing a crime. I'm asking my fellow commissioners tonight, help us find a path forward. Given the caveats we've heard about, along with their potential remedies, please help us move this path forward and agree to have our skilled staff continue to work with our community partners and bring us a community ID and an ordinance that we can bring forward for discussion and ultimately a vote. In closing, I just want to say thank you so sincerely to Commissioners Johnson and Ramirez, Commissioner McKiernan, and the members of the Safe and Welcoming Coalition who've been meeting regularly with us for more than 6 months to bring us to tonight. Thank you all.
I will go next. Thank you, Commissioner Bynum. My name is Commissioner Christian Ramirez. I'm going to make a statement. Part of it's written, part of it I'll speak. I'm a proud Mexican American, a byproduct of an immigrant family. I have a deep understanding of the benefits of this ordinance. My grandfather was a proud Mexican and a proud American. To show that, he gave back to the Rosedale community by opening a general grocery store, which is no longer open, unfortunately. But he was given that opportunity to provide for the community. That's what this ordinance does. It strengthens that opportunity for everyone to partake in this community, to partake in this government. That's why I am a strong, staunch supporter of the safe and welcoming. It may not affect everybody. It may affect a small group of people, but that doesn't mean we can't or we shouldn't protect them at all costs. They give to this community. They are the people who work in our grocery stores. They're the people that work in our schools. We don't understand the reasons they may be here for being undocumented. We may not know, we may not understand, but that doesn't mean we shouldn't be sympathetic to them or empathetic to them. So when we started this task force and I met with Commissioner Johnson, Commissioner Bynum, and the task force and the other Safe and Welcoming Coalition members, one of the things I mentioned on the beginning was the one thing inevitable in government and politics is compromise. Whatever happens in the end, both sides are going to have to give and take. That's what happens. But I don't want us to give and take too much where we don't do and where the ordinance does nothing. So to my fellow colleagues and commissioners, have an open mind. Let's have an honest dialogue, open dialogue on this topic, because it's very important to me. Like I said, being a byproduct of an immigrant family, I know what this could do for a family. Thank you.
Well, this is Commissioner McKiernan. Thank you, Commissioners Bynum and Ramirez. I'm a late addition to the coalition that's been meeting. I'm the person who sought out the Faith Action ID folks in North Carolina. I thought that they had a very workable model for us to follow, in that it is not a municipal ID, but rather an ID that is based in community and recognized by the municipality. They have enacted this program. They have a system. And so they have a proven system that can work, and as close as Des Moines, Iowa, they have a system that's in place. The specifics of a potential community ID program are yet to be worked out by us, but I think that's achievable. I think it's reasonable that we can achieve those. But I have some other things for us to consider, even if or even as we put a community ID program into place. And that would be, what programs are we going to set up to take those people who get a community ID beyond the community ID to getting what would be considered, and I don't know how else to put it other than with air quotes, an official ID. I think we stop short, and we won't realize a true gain if we don't think about how we take the next step for those folks who are at the present without an ID that they can use in our community. Another thing that worries me about the ID program is that it's very insular. It is going to be in one city out of the 24 cities of the 7-county metro area. I think that any ID program is going to be stronger if it is more broadly applicable across all of the communities of the metro area. So as we continue to talk about this, we have to think, how do we, how can we, how should we engage other communities in the 7-county metro area to also consider either creating their own ID program, using the Faith Action community ID model, and how do we all see each other's attempts at this? Because ultimately, I think that there is a more limited value if it is only useful, so to speak, in Kansas City, Kansas. I think I've been pretty clear with everybody on the coalition, with my fellow commissioners, that I am still concerned. I still have unanswered question and unresolved concerns about the ICE non-compliance portion of the Safe and Welcoming Ordinance. I've gotten some more information just this week that is letting me think a little bit more about that. That is helping me to shape my questions so that hopefully I can get answers that will allow me to move forward. But I will say that at this time, I still have unanswered questions and some unresolved concerns about how we would enact an ICE non-compliance ordinance within Kansas City, Kansas. Thank you.
Mayor, again, I just want to appreciate the fact that you've allowed us to have this conversation. I thank my fellow commissioners for their comments. And at this time, I will yield the floor back to you and the commission for further dialogue.
Thank you, Commissioner Johnson. Thank you for all your work you've done. Any questions or comments from commission? Commissioner Walters?
Yes, thank you. I thought I might just chime in. I would really like to hear from the police chief on this, just so we get all perspectives. The question that I wrote down when I was listening to the presentation is, how often do we get requests for cooperation from ICE? Is this something that happens regularly, or is it hardly ever happen? Because it sounds like we're being put in a position of trying to evaluate whether the benefits of this program will offset the potential negatives. And I'm maybe kind of on the same page as Commissioner McKiernan on that. I really want to know the downsides. And if we've eliminated those downsides, that's fantastic. But if there are, as Susan Alex said, there are unintended consequences that might rear their heads, we need to go into this with our eyes wide open. And the other thing I would really like to request, if it's possible, is of the cities that have adopted a similar program to ours, if there is one that's identical, that would be great, but similar, have the benefits been realized, or is it more just feelings? Hard data would be very nice to see if it exists, and so that we can actually look and say, yes, these are tangible benefits that these cities were able to enjoy based on their adoption of this, compared to other cities that did not have these benefits, so that we can know for sure that it's worth the risk. Thank you.
Thank you. Commissioner Markley.
Thank you, Mayor. I would be curious to know this faith action model, does it require a similar ICE noncompliance ordinance, or depending on, I guess, whether you're county or city government at that point, resolution, or do we know if the cities that are using that model are adopting similar language?
I will say that in my conversation with the director of that program, that it was his position that no, that you could implement their community ID program without necessarily having an ICE noncompliance ordinance in your community. That was his position. That needs to be examined further.
This is Commissioner Bynum. I think that some of the cities that have the community ID do also have what we are calling safe and welcoming. So while it may not be necessary, they tend to go hand in hand. And to Commissioner Walters and Commissioner Markley, and I know we'll have more questions, I think we have some of those answers among our coalition members, and we certainly want to get the rest of those answers. And so that's why I'm so appreciative of your questions, because it tells me that you're willing to continue to learn about it. So thanks.
Commissioner Philbrook.
Yes, there was a little statement in there from legal and from our folks, other folks, that of course they would have to put out a request, okay, for somebody to do the ID. And so if the city is handling it, yes, but if the city is not handling it and the community is handling this project, then we don't have to put out a request, as I understand it. They can do it, but maybe we could have an MU or an understanding with that organization as to how the city would treat that particular ID. So that's just one of those way arounds, maybe, Casey. I don't know. You know, it's just a suggestion, because I'm kind of like some of the rest of the commissioners. We don't like to look at fatalism. We kind of want to look for a way through and how to make things work so everybody can benefit. So that's just a suggestion and a question on that. Then let's see, what else did I want to add? So I have some of the same questions that Brian does along with the other two commissioners. So I'm not ready to say, yay, we're going to do this. What I'm ready to say is I think that we definitely need to look this over and make sure that we all understand everything excruciatingly well to move forward. That's all. I'm not anti it, that is for sure. I want to see it work. But I want to make sure when we do it that it works in a very, and I don't want to use the word fair, because that word is so overused, because it depends on who wins the game, what it's fair or not. But looking at it in a way that actually works for the full community. So we're not leaving people out of this. I'd also like to make a suggestion, and we mentioned this mentioned in there earlier about businesses. And so I'm going to throw the Chamber of Commerce under the bus right now and say, you know, I think that the Chamber of Commerce could help with businesses getting on board with this if we could consider this ID not just an ID for people that don't have any IDs, but possibly an ID for anybody in the community that wants it, so that works here or lives here, so they could use it as a discount card with businesses. So that would keep our businesses a little busier. It would help them. It would pull them on board as actually being part of a community solution. And that's it. Thanks.
Commissioner Ramirez.
Thank you, Mr. Mayor. I have a question to our legal. Back in the beginning when we started, then Chief Counsel, I am blanking, Chief Moore, when he was the Chief Counsel at the time, he provided us, I don't remember if it was the full commission or just the 3 commissioners that have been part of the Safe and Welcoming Task Force, but he provided us the certification documents that were signed with one of the grants that is part of the our legal department's argument against against the non-compliance provision. What if and I have the document in front of me, and if not all commissioners have it, I believe we should all have this same document. But what if in the document it says that if the condition of citizenship and immigration status communication, the local government cannot prohibit or restrict any communication? What if in the document it says that if that condition or provision is of utter invalidity or unenforceability, such conditions shall be deemed severable from this award? And we have heard from ACL, from Lauren Bonds, that multiple court cases have said that this condition of the citizenship and immigration status communication is invalid and unenforceable. So if that provision is in this document, doesn't that, I'm not going to say negate, but not put too much force in the legal department's argument?
So that's pretty standard language in grant assurances and also contracts, saying that if something turns out to be invalid, the rest of the document will still hold up. We do not have a controlling opinion from the 10th Circuit, which is where we are. And so the summary of law that you heard from Ms. Bonds is true. I, as Unified Government Counsel, just may be a little bit more cautious. So, we're going to be on more solid ground if we have an actual controlling opinion from the district where we're located, and we don't have that yet.
But I would, and I am not a lawyer in any way, shape, or form. I don't have training in any of this, but we see it's not saying that there's only 1 or 2 circuit courts. There's multiple circuit courts who have had this same conclusion. Can't we, I know we in law, you can't assume, but couldn't you assume that the 10th Circuit could as well follow same suit as the other circuit courts? Like I said, it's been multiple, not just 1 or 2.
So that just wouldn't be my cautious legal advice. It's certainly a direction that the commission as a whole could choose to go. The legal department can't tell you no. We can only advise you of what the risks might be. So the other concern would be we signed assurances saying we do things a certain way. So if it turns out that the commission wants to go that direction, we can kind of look at that scenario and give you some more detail about what we think is likely to happen.
Commissioner Ramirez, may I jump in here quickly?
Yes.
Thank you. So this is Lauren Bonds again. So I just would like to point out that the 10th Circuit Court of Appeals is likely to rule on this issue very soon. So I think that we will have not a binding decision from the district, which would not be the only relevant controlling court, but from the Federal Circuit Court of Appeals that contains the District Court of Kansas. That was part of my presentation, but maybe got a little bit too legalese. So I wanted to make sure that that was clear, that that's a pending appeal that the state of Colorado won against the Department of Justice. So I think it's very likely that there will be a controlling opinion that would make those conditions severable. Additionally, I'd just like to remind folks that we created a provision in a change to the proposed statutory or ordinance provision that would address that concern, acknowledging that if there is a binding contractual condition, which we would defer to your legal counsel and your all's legal conclusion in making that determination, I think we have a workaround there to acknowledge that these conditions are in place. And I would also just note that, all those circuit opinions are not just relevant for determining whether whether the legal decisions are binding, but also to note that there are all these major cities that people have a lot of respect for and a lot of confidence in, that have a lot of credibility, who are saying that these conditions are clearly unconstitutional. So I think that this concern about undermining the unified government's role as a party to a contract and undermining their credibility for future contracts, you need to look at the national scope for that too, because people aren't going to throw out Chicago anymore. They're not going to throw out Providence. They're not going to throw out the whole state of Colorado for federal grants on the basis of the fact that they're refusing to comply with these clearly unconstitutional conditions. So I think that's a very important point to note with respect to concerns about the unified government's credibility going forward.
Thank you, Lauren, for the clarification. Thank you for that. That was all the questions I had for our legal department. Thank you, Mr. Mayor.
Commissioner Burrows.
Thank you, Mayor. Lauren, I remember talking with Micah, who at the time was the director of the ACLU. And then I met with Signish, and then I met with Ms. Harmon. I think all of those were your predecessors. I have not had the privilege of meeting you, but in talking with them early on, when I was first elected, I did arrange a meeting with our local law enforcement, with the sheriff and with the police chief, with Ms. Harmon, only to find out that the ACLU had attacked our Kansas City, Kansas Police Department publicly. And that brought a little bit of consternation. But I want to get back to what I want to ensure in legal, the cost of implementing a program, if it will be borne by the unified government, if it's something we need to budget for. I'd like some kind of response as to a cost if we do have to bear that price. The I've seen the identity cards that are used by the faith-based organization that Commissioner McKiernan addressed, and it did give me a higher comfort level when I seen a number on the top, and basically I'll call it an ID number for a repository that had information about that individual. And that I guess there's the communications I'm having a problem with, and that's, I don't like the message that this will be used to build trust with our police. Our police are our public safety servants that are there to serve the law. And we have a working relationship with members of our community. Don't break the law, won't interact with the police. And I just don't like that message, that to build the trust, because I think it sends a negative impression and a negative image to our law enforcement community, who have been willing to have this discussion in a frank and open discussion. I've also requested years ago that this organization that was pushing for the municipal ID at the time bring forward documentation from other communities, other community leaders, other police chiefs across the nation that have gone through this, so that we know that we're not going to create the first system in which we implement this. It's already been tried and true, and get some of the input from them. And I have yet to see those letters in the 4 years I've requested those, because we looked at it on doing some kind of legislation on the state side assist in moving forward when we had to push back against the sanctuary cities issue. So I guess I'm a little concerned about the message about building trust, because I think that sends the wrong message. I like to think that we can build a community relationship with those in our community that may be concerned about interacting with our law enforcement. I think that's a better message than the negative perception that I believe it puts forward. And two, I'd like to see some documents from some mayors, some county commissioners, and law enforcement of other communities that have succeeded with this program, and what weaknesses they find in it and what's the strengths in it. And I like the return on investment that somebody talked about to ensure that, I think it was Commissioner McKiernan brought forward. But those are some of my concerns and questions. I think that we have an opportunity here to bring people to the community, to the table, and to bridge those concerns and to find that sense of community that Commissioner Ramirez talked about. If we can get those questions put forward, I'll be more than happy to continue the discussion. But Ms. Bonds, I look forward to having an opportunity to meet with you also.
Thank you. Commissioner Kane?
Thank you, Mayor. Some of you guys stole my thunder. You know, Commissioner Burrow is talking about some of those things, you know, that we have the utmost respect for our police department. But when I was first approached about this, I asked the person that I was talking to, where was the police department? They said, they're right with us. So right there was the chief, and I walked over and asked him. He said, no, we're not with it. And, you know, we talk about bumps in the road, and we're always encouraged to follow what staff says. How big are those bumps? How much money would we lose if we do this? If we've already had agreements that we've signed, are we going to lose any monies? How much does it cost to continue to run? And then I know that you're going to have a list of how successful this was in X amount of places, but you should also have a list of how it failed somewhere. And I don't want to talk about Chicago. I want to talk about a municipality our size. You know, because we're not huge and we're not small. So I would rather you get something that says, okay, it worked in a municipality this big. And then how is it going to affect us in the long run? And this next thing I don't want to say because I'm not sure if it'll come out right. I've been here 15 years, never ran across something like this. And I don't think that this particular issue should be decided by 11 people. If we're really going to do this, we should involve the entire community and bring it to a vote. And the reason I say that is a lot of people watch what we're doing, but a lot of people don't. So not only do we need to educate ourselves, but we would have to educate the community. And I think that's the way to address it. I mean, we can take it on, we can look at it, we can all say, all right, this is what we want. But at the end of the day, something this big should go to the voters. And I think that would be, once we get all our stuff together, and it may not be here in the next 5-6 months, but when we get everything together, then bring it to the vote and let the community decide, is this the right thing for us? That's it, Mayor. Thank you.
Thank you, Commissioner. I have just a couple of thoughts here. First of all, so, and this is for Casey and perhaps Susan, are we currently, or have we held a person beyond the time for which they are incarcerated or denied them bail because of an ICE detainer?
So currently we do not recognize the informal detainer requests that are not supported by probable cause. We do not hold beyond what the Fourth Amendment permits. So that is not something that the detention center does.
And we would have the same answer on behalf of the police department.
So I think so. I'm trying to wrap my head around this. And first of all, I want to say thanks to for the materials we received, the one pager from ACLU, that was very descriptive. But so Casey and Susan, from your perspective, the very thing that we would enact in a non-ICE compliance ordinance is already in effect? Is that police and sheriff department procedures, policies? And so would we in fact be changing practice by enacting this?
So I will let Susan speak a little in addition to this, but the issue is the draft the ACLU or the Safe and Welcoming group put forward. It's very broad, and it basically prohibits, for example, communication between employees of the unified government and Department of Homeland Security or ICE. And Susan, you can correct me if I'm wrong, but because of the broadness is part of the problem. And so, for example, the police department has multiple federal task forces they participate in, and they have to be able to communicate with all of the agents on those task forces to be able to do their job. And if that prohibition were included, then yes, it would conflict with our current practice. But if you're solely talking about whether or not the police department holds people beyond what's allowed in a judicial warrant, then no, the police department doesn't do that.
The reason I'm asking is because there was some very good case law or judicial proceedings that ACLU provided that showed the risk that we would be at in terms of lawsuits if because of violation of Fourth Amendment rights. But currently, we are not at risk because we do not accept ICE detainers, the warrantless detainers, unless there is establishment of probable cause by the proper judicial authority. Is that accurate?
That's correct.
Yes.
Okay. Okay. Do we have, and so I'm going to go back to Commissioner Walters' suggestion. Again, I'd like to, hear from the police chief, the sheriff on this as we move forward. But are we currently enforcing any detainers whatsoever? Have we in the last, couple of years that this has been under discussion, have we had any instance where we have someone has been deported subject to the actions of our police or our law enforcement?
I would say that I don't have the data, but that is likely. The way the federal immigration deportation system works is when a person is booked into a detention center for a crime, the ICE database receives information, and that is often where ICE intersects with people. So that is just how the system is set up, and it is likely that people have been picked up by ICE as a result of being arrested.
Mayor Alvey, may I? I think that we would be able to have.
Yeah, no, just a moment, please. I'm sorry.
Yeah, I would just note that we have some data to support our concerns about individuals being deported for when they have never been convicted or even charged with any type of serious crime. So we would be able to provide the commission with that.
Right. Well, and I guess the question would come down to whether that was under immigration law, someone was deported and they followed proper procedure and followed the law and process, and they might have been deported because their name did pop up on that database. But so Casey and Susan, do you know in other, and I would like to find this out, in other jurisdictions where they have adopted a safe and welcoming ordinance, did they are there still people deported because part of the process is that the database ICE picks it up from the database and follows proceedings.
Yeah, we can certainly research that. ICE would be able to, people's release dates are public, so ICE would be able to just wait outside a detention center and pick somebody up that way.
And so is the information that is shared available to ICE through the detention center, is that, obviously it's federal law, is that just administrative action by ICE that is subject to change by executive order? I'm just trying to figure out how this works.
We're getting out past what I know. I'm sure that an executive order can affect it. ICE can change its tactics based on the directions receiving from the top.
Right. So I just, thank you. And I just have one more comment. Again, we've only got about 5 minutes left, but so I understand, Lauren, you suggested that prior to 2017, these kinds of requirements on grants were not part of grant procedures and don't anticipate them to be present moving forward now. But do we not also, then could we not also assume that the request for us to accept, detainers would shift as well?
I think that's a great question, Mayor Alvey. I think, unfortunately, that is not something that is an innovation of the prior administration. Immigration detainers, and if you look at all the case law that we provided as part of the materials, that does predate 2017. So I think this detainer question is one that you'll constantly have to be on guard for going forward, even with the Biden administration and their professions of, I think, being more inclusive of immigrant communities.
Okay, thank you. That's all I have. We have about 4 minutes left, or 3 minutes. I want to hold us to that because we do have to shift technology over. Commissioner Bynum.
Thank you, Mayor. All I'm asking for us to do tonight is continue to move our conversation forward. There is a toolkit called Certified Welcoming, and we can look to that for some of the resources on our community engagement. I really do appreciate the request for data. And we need the data. And we also need a good amount of civic involvement around the issue, and we have good tools for that. So all I'm asking tonight is that we can agree to continue the conversation, Mayor. Thank you.
Thank you. Commissioner Ramirez, you'll have the last word.
Thank you, Mr. Mayor. I want to, just in ending, mirror the words of Commissioner Bynum. This task force we have been working since March together, and I want that work to continue, but with us as a commission, us continuing the conversation, finding that middle ground so that we are all happy, so that our community is safe, our police officers are safe. That is our ultimate goal. And I just, one last thing, I just want to say that, this ordinance isn't trying, because I know that this is from the previous presidential administration, this ordinance isn't trying to create a sanctuary city. I will say personally, I hate that word. We are not wanting to be saved. We are just wanting to be welcomed. And so that's what I will leave tonight is let us work together so that we can be welcomed. Thank you.
Okay, thank you for all the work and all the thought that goes into this. There's more to be done. And I think that we're going to continue to have this discussion. Thank you all very much. And we will reconvene at 7 o'clock. Thank you.